And as cases continue to steadily decline, the state's coronavirus task force on racial disparities revealed its findings on why COVID hit communities of color so hard. And the answers are fairly straightforward. Let's get to Sean Lay. He's live tonight with what the leader of the group, Lieutenant Governor Garland Gilchrist, had to say about it. Sean.
Good evening, Kimberly. Really important work by this task force. It had two goals. One, saving lives. The other, finding solutions. Here's what they found so far.
And I just want to be personal. I've lost 27 people to COVID-19 in my own life, and many of them were Black Michiganders.
When COVID hit, it became instantly clear that COVID hits different in our African American communities and continues to do damage. But why? That's what the state of Michigan wanted to find out by forming the Michigan Coronavirus Task Force on Racial Disparities to study trends in infections, deaths, health care, the lack of health insurance, and how all of that plays a role in people of color suffering more from COVID than any other group.
Because a lot of people of color in Michigan don't have doctors or didn't have doctors that were present in their neighborhoods and communities. So we connected them with navigators to help them find access to primary care, because regardless of your COVID-19 test result, it's easier to be healthy if you have a relationship with a medical professional.
By digging deep for answers, a positive impact is being made, where there continues to be a laser focus on COVID testing, COVID vaccines, and plugging those life-saving resources into our schools.
Because you know who a lot of people trust in the community? The nurse at their neighborhood elementary school.
Back here live, the pandemic may feel like it's winding down for many of us, but the task force and Gilchrist also says their work remains important and they can continue to keep it up week after week. Kimberly.
So, Sean, what comes next here after, these findings?
One thing that really stood out was connecting people, especially here in Detroit or Metro Detroit, and people of color with a primary care physician, something that a lot of us may take for granted, but remains a challenge, and they're going to continue to try to make those links.
Yeah. Okay. Sean, thanks.